Hello, and welcome to Pillpro. What is quinine sulfate? Quinine sulfate is an alkaloid derived from the bark of the cinchona tree. It works by killing the malaria parasites in the red blood cells of the affected person. Quinine sulfate is available in the form of tablets, capsules, or injection. Uses of quinine sulfate. As mentioned earlier, quinine sulfate is used for the treatment of malaria. It is also used for the treatment of other diseases such as legcramps and off-label for nocturnal leg cramps. Dosage and administration. The dosage of quinine sulfate depends on the type and severity of the disease being treated, as well as the patient's weight and medical history. It is usually taken by mouth, and the recommended dose for adults is 640 mg every 8 hours for 7 days. Quinine sulfate can also be given by injection if the patient is unable to take it by mouth. Potential side effects and risks. Like all medications, quinine sulfate can cause side effects. Some of the common side effects include headache, nausea, vomiting, diarrhea, and abdominal pain. However, more serious side effects such as hearing loss, vision changes, or even life-threatening allergic reactions can also occur. Interactions with other medications. Quinine sulfate can interact with other medications such as blood thinners, heart medications, and some antibiotics. It is important to inform your healthcare provider about all the medications you are taking to prevent any potential drug interactions. Alternatives to quinine sulfate. Although quinine sulfate is an effective treatment for malaria and leg cramps, there are other medications available for these conditions as well. Your healthcare provider can provide you with alternatives if quinine sulfate is not suitable for you. General safety tips. It is important to follow your healthcare provider's instructions for taking quinine sulfate. Do not take more than the recommended dose or for a longer period than prescribed. Additionally, do not stop taking quinine sulfate without consulting your healthcare provider. Even if you feel better, if you experience any adverse effects, contact your healthcare provider immediately. Conclusion. In conclusion, quinine sulfate is an important medication for the treatment of malaria and other diseases. However, it is important to be aware of its potential side effects and interactions with other medications.